The time that you think that it doesn't matter is probably the day the surveyor is going to show up. Yeah, don't dress like a professional hooker. Hi, I'm Teresa Register, and I am the Corporate Compliance Auditor at Healing Hands Healthcare in Wichita Falls, Texas. I have been in the home health industry for over 30-some years, and I have held a number of positions over the years, everything from doing direct care to middle, senior, and regional management, and have been the Vice President for Clinical Services at a Visiting Nurse Association, and I've been a surveyor for about 7 years prior to my work here at Healing Hands. The reason I am doing this is I know there are really, really good people out there trying to make their agencies the best they can be. And I just want to make sure that those people have the tools and have the knowledge to always put their best foot forward and make the best possible impression that they can make. It is a rare exception that once I've had a strong impression about an agency, being unprepared and not particularly concerned about quality, rarely does that turn around. What I wanted to talk to you about today is being aware of the kind of information that surveyors collect about you before they even show up at your agency. And as you have undoubtedly heard and probably said in the past sometime, you never get a second chance to make a first impression. This definitely does apply to your agency's survey process. Your public information coupled with the surveyor's impressions before and during the first few hours of your survey are critical because they set the tone for the rest of the survey. This is when you either give an overall positive impression or a negative one. So it's extremely important that your initial impressions are positive. What I wanted to spend a little time talking about is what happens before your survey. If you are involved with an accrediting organization that asks you to do a self-study, or if you have information that's in the public domain about your previous survey performance, a surveyor will have access to that information, and they will look at your past survey history and any deficiencies that you've previously had, including a plan of correction that you have submitted. In some cases, home health agencies will actually hire someone to write their self-study, and a surveyor will always be able to tell if a consultant wrote a self-study or if agency personnel actually wrote their own self-study. It's always desirable if a team of people at your home health agency actually do your own self-study. In those situations, the actual documentation is always much more believable, more real, and it is always better to do it because then you are prepared to answer questions when the surveyor arrives. You will have already had to answer those same questions in writing, and you will already be cued in that those questions are going to show up again during the survey. Another source of information that surveyors will look at and look for is anything that's on social media or on the internet about your organization. In many cases, agencies have a website already. The surveyor will look to see what services you provide. They will look at any historical information, when the agency was started, so they'll look to see how long you've been in business. They will begin to formulate an idea of where you should be in your process of maturation as an organization. So be aware that in all likelihood, the surveyor will have looked at anything they can find on the internet about your agency. So after a surveyor has received information about your agency's profile and they've received an assignment, they know they're coming to your particular city and your agency, they are going to be looking at a number of things about your setting. They're going to look at the building, the property. They're partly going to be concerned about a level of safety and the kind of area where your agency is located. And there's some questions that you may want to ask yourself about your particular setting and your building itself. So when was the last time you approached your particular agency and looked at it from a consumer's standpoint? Some of the things you may want to look at anew would be the cleanliness around your building, the actual cleanliness of the building itself. Is there litter around the parking lot, the parking area? Are there cigarette butts on the ground? That is very distracting. There may be gum stuck all over the sidewalk. There may be cans and trash around in the periphery of the parking lot. I've seen that many, many times. And you just need to maybe look again at the physical setting. Sometimes we become blind to those kinds of things, and because we see it every day. So look at anything that you can do to make a more favorable impression. If you're renting space, and most agencies do rent space, if you have problems that need to be fixed, give your landlord notice and ask them to fix it as soon as possible. And let them know that you're trying to put your best foot forward and that you will be going through a survey, and it would mean a lot to you for them to get it fixed. Be persistent, because appearances do matter. Another thing that surveyors will be noticing is the personal appearance of your staff. When you are looking objectively at your clinicians, you want to pay attention to whether or not they're following your agency's dress code. In particular, obviously you want them to be well groomed, and you want them to be wearing scrubs that are neat, clean, ironed. If you have a policy that specifies, for example, that your clinical staff are not to use artificial fingernails or wear heavy perfume or dangly earrings, again, make sure that they're in compliance with that. Surveyors will look at all of your policies, and they'll look to see if your staff are following your agency's dress code. As an example, when I was talking about how important it is to make a good first impression, I was at an agency where the person who I first ran into looked like she was ready to go clubbing, and obviously did not make a good impression that she was very professional. Other considerations I would include in first impressions. A lot of surveyors will not be real obvious that they've arrived at the agency, and they'll come a little bit early and park in the parking lot and just listen and watch the staff coming and going. They'll listen to see if they hear any discussion about patient-specific information. They will also, if you have a lobby area that's a public area, if your agency is not on a ground level, a lot of times they will go to the elevator and see who's coming and going and listen for any kind of HIPAA violations. To re-emphasize, elevators are dangerous. If you are not on the ground floor and people are coming and going from your agency on an elevator, sometimes the staff get so accustomed to that space that they almost see it as an extension of the agency, and they get careless about some of the things that they say. Not just about patients, but sometimes they will make comments about the agency itself while they're in the elevators. And so you want to make sure that you are not getting careless about conversations anywhere in public. They will also be paying attention to what's going on with the vehicles that are being driven. A lot of staff will open their trunks and they'll put things in their trunks and take things out. So surveyors are looking to see if you have clean or dirty supply boxes in your trunk or in your vehicle, and what kind of supply bags are being used. In a lot of cases, agencies have begun using roller bags, and yet the agency's policy and procedures don't allow for roller bags. So again, they're going to be, the surveyors are going to be taking in all of this kind of information. I like to say that surveyors are kind of like mothers. They have eyes in the backs of their heads and ears that hear everything that's said within a mile. So, there's a fine line between being petrified and being aware. And so I'm just saying some of these things so it increases the awareness. Another important thing is when an agency posts their business hours, you want to make sure that there is someone there to open the door in a timely manner. I have been in so many places where I've arrived to do a survey and the door is locked. There's nobody there. I've waited 45 minutes or so, tried to reach someone and not get a phone call back, and nobody shows up, for a significant amount of time. And obviously that makes a really bad impression. The fact is that surveyors are very rushed for time. The whole time they are trying to do a survey, they have literally every minute is critical for them to get through the process. So the last thing you want to do is waste a surveyor's time. If they arrive at the agency and they're sitting in the parking lot waiting for a call back, waiting for someone to show up at the agency, you're already in trouble. As far as signage, you should be aware that it's required that the signage is clearly documented, not only your street address and the name of the agency, but on a sign next to the agency door or on the door should be posted your business hours, a daytime phone, and after hours phone number, just in case anyone needs to reach the on-call staff. The most important person for the surveyor to meet when they arrive is the first person that they meet. What I mean by that is that you never know who the first person's going to be that the surveyor runs into at your agency. It may be a very lovely, well-groomed receptionist, or it may be someone who is not going to make a good impression. And so it's important that you realize that your weakest employee could be the person that makes the first impression with your surveyor. So it's important to make sure that as much as possible, every person is hospitable and understands exactly what they should do if they are the first person the surveyor encounters. You want to make sure that anyone that initially greets a surveyor is knowledgeable about who to send the surveyor to as the second person, and that person is usually a receptionist, and that person then is going to hopefully be real knowledgeable in how to handle the entrance process for a surveyor. So what I have done in agencies is hold a drill, and I've actually done this fairly frequently, to just desensitize the receptionist and make sure that when a surveyor walks in, it's almost automatic that they know exactly what to do to make that surveyor feel comfortable and to get them started off on the right foot. So in our next video, I'm going to give you some suggestions, insights, and tools to make the next part of the process a lot more comfortable for you. I guess to summarize, I would just say make sure that you educate your staff about the importance of the first impression, and that everyone is, feels like they're knowledgeable enough that they're going to have a pretty good level of confidence if they're the first person that the surveyor encounters. So in the videos to follow, I am planning to give you a lot more detail about what you need to do to prepare now for the inevitable, and then what you can do when the surveyor actually arrives, and to give you an overview of what to expect of the survey process, as well as maybe going into some detail to help you understand how to disagree with a surveyor and how to write a plan of correction. So that's all for now, and I will see you again on a future video.